Bariatric surgery is surgery that intends to help patients lose weight, and by doing so, we hope that the weight loss leads to resolution of their comorbidities such as cholesterol, high blood pressure, diabetes, chronic back pain, chronic joint pain, and other problems that patients can face.
When the patients come in, we have a biometric scale that we weigh them on. That gives us a lot of information on the patient. It tells us what their fat mass is, tells us their muscle mass, their water weight, but one of the important numbers that it gives me is their basal metabolic rate, which is the amount of calories that their body needs when they're at rest. So we take that basal metabolic rate and we use that to make recommendations as far as what kind of calorie diet that they need to be on.
So the process is a slightly long process, but for good reasons, we believe. After the patient shows interest and either they're referred or they self-refer to our office, they'll be meeting their surgeon on their first visit.
Everybody's a little different and every insurance company's a little different, but for the most part, most people have to go through a period of 3 to 6 months of monitored dieting, which we do here at the Weight Loss Center. Everybody has to go through a upper endoscopy where we look at your stomach and make sure that your esophagus or your feeding tube is okay for this kind of surgery. And then everyone has to go through a psychological and nutritional evaluation before surgeries.
The current recommendations is for patients with a body mass index over 40 and without any comorbidities or medical problems, and all patients with a body mass index over 35 with certain comorbidities.
After bariatric surgery, the recovery, because we do our surgeries robotically, is actually less than other techniques. Most people are back up and getting around back to life within a week or so after surgery.
So what the robotics platform provides is improved visualization compared to laparoscopic surgery and reticulating instruments that help us sew and operate more comfortably compared to a laparoscopic surgery. Ultimately, this also helps us as surgeons in improving our longevity as it's less stressful on our bodies to operate.
I think part of what sets us apart is that we understand where the patients are coming from. From my standpoint, I've struggled with weight. I've had weight loss surgery myself in the past. So I think that that's something big that we can help patients with. We just understand where they're coming from.
Well, research shows that at the 2-year mark, people that undergo a gastric sleeve lose about 60% of their body weight. People undergoing a bypass undergo about 70% of loss of their body weight. Here at the Weight Loss Center, we really do try to take into consideration the patient as a whole, and that it's not just about getting an operation done. This is about healing people, and this starts from a medical health and also with mental health. We're not about trying to do as many surgeries as possible. We're trying to have successful surgeries, and we want our patients to come back to us a year later and say, this is the best thing I ever had done. Not say, I wish I'd never had anything done.